There's many things that affect healthcare, but in that context what was going on here was post-Katrina. We had been growing our surgical services before that. We recruited a lot of surgeons and we were growing, but Katrina brought a whole another level of change and complexity and volume to us. We had a plan to build out our surgical services area, but it was going to be 18, 24 months before we could do that. In essence, we wanted to reduce the stress on our staff, reduce overtime. We wanted throughput, where patients came here, they were treated very efficiently and effectively, and they went out the door for the ambulatory surgery part of it. We wanted to continue to improve patient satisfaction and sustain high levels of patient satisfaction, and so those were our goals. We had made several attempts and made some improvements in that surgical services area, but it was not enough, and therefore we needed some help from the outside. And we don't do that in everything we do. We do a lot of stuff ourselves. We take pride in that. But it was a situation where we needed a change, we needed it quickly, and we needed the momentum and the intelligence and support in a certain sense to really move the paradigm forward quickly. When you bring third parties in, I've learned it's not just the company, but it's also the individuals in that company. Can they work with you? Can you work with them? Can you trust them? With GE, I have found over the years we relate pretty well to each other. The things they believe in, like accountability, that's a fundamental premise on how we run this hospital, being accountable. And no nonsense, no excuses, all those kind of things work well for us. But also GE has a depth of knowledge of these kind of things and of processes in general, and that was important to me, that it wasn't superficial. We figured there would be some difficulties along the way, and there were. As I said, it was not a walk in the park, and so having the discipline, the knowledge, the ability to communicate effectively, the ability to relate to our culture, the judgment to move at a pace. We wanted to move quickly, but we couldn't move so fast that it would just blow up in our faces. And then really the ultimate test is, can you get the results, and can you sustain them? So that's a deeper, more meaningful change that has really gotten to the root of the issue and addressed it properly.